Good evening, everyone. I hope you're well and welcome to our webinar on Mona Lisa Touch. My name's Louise and I'm your host. Our expert presenter this evening is Mr. Rowan Connell, Consultant Gynaecologist at Bendon Hospital. His presentation will be followed by a Q&A session. If you'd like to ask a question, then please do so via the Q&A icon at the bottom of the screen. You can do this with or without including your name. Just to remind you, this webinar is being recorded. So if you don't want to be part of the recording, just ensure that you don't include your name within the Q&A. I'll now hand over to Mr. Connell, and you'll hear from me again shortly for the questions and answers. Thank you.
Thank you very much, and welcome to everybody. My name is Rowan Connell. I'm a consultant gynaecologist at Bendon Hospital, and I'm going to be talking to you about the Mona Lisa Touch. So a little bit about me. I started off my medical training going down the route of general surgery and concentrated quite a lot on breast surgery and breast cancer in particular. And I trained in London and the Southeast mostly. Around the time that I was training, keyhole surgery started coming in as more and more as a profession. And I met up with quite a key gynecologist at the time who were using laser keyhole surgery for hysterectomies. I thought this was a fantastic advance in surgery because of recovery, etc., and moved over from general surgery to gynecology at the time and laparoscopic surgery in specifically. 2003, I was a consultant in the southeast of England, and initially really specialised in keyhole surgery, but also moved into urogynecology, which is essentially incontinence, vaginal prolapse, and pelvic floor reconstruction. And then the story continues that because those conditions tend to affect the older women and the menopausal women, I also developed an interest in menopause. Mona Lisa Touch was first developed really in Milan with Stefano Salvatore, who I worked with at King's a long time ago, and had lots of dealings with him over those first few years in the research, and brought it to Bendon Hospital in 2017, or I should say that Bendon had a lot of foresight about where this treatment could lead for the benefit of women. The problem in a lot of healthcare, of course, is that we don't prevent things. We tend to have a knee-jerk reaction to treatment of problems. So I've put the prevention in brackets, but essentially the Mona Lisa Touch is for women who have uncomfortable vaginal symptoms or vaginal dryness. And initially it was thought this would be in the menopause, because we know that about 40% or more of menopausal women will have these symptoms. We quite quickly found that actually we were tending to see women who are more perimenopausal, so around the time of the menopause being approximately 52. And those women were 45 to 60 with all these terrible symptoms. And I think there is a subgroup of women who are very sensitive to the hormones going down as they get closer to the menopause. And of course, this condition I think is very similar to impotence in men, in that it's very much an unspoken disease or condition, because women don't want to talk about their sore vaginas or pain with intercourse in the same way that men don't want to talk about their impotence and not having erections. And of course, we had a huge increase in the number of people coming forward when Davina McCall had her recent television program about menopause, and she talked about soreness in the vagina for a few minutes then. And of course, because it's a condition of lowering of estrogen, you do see this in a number of women after they've had their babies, where they're breastfeeding, where the estrogen levels go down. And especially we see it in women who have breast cancer treatment, and I'll talk about that in a minute. So you may have looked up on the internet as the genitourinary symptom of the menopause, or GSM. I tended to call it laser vaginal rejuvenation, but essentially it's vaginal dryness, itchiness, and that burning and pain with intercourse. on websites, they'll talk about vaginal laxity, and I'll talk about that a bit later on, but the vaginal laxity, we don't use this as a prolapse procedure. We use this as a thickening of the vagina. So obviously, if you've got a feeling of laxity in the vagina, we can thicken it, then that feeling will go down. There's also a lot of sales pitch, not from me, but from the company, about mild bladder issues, so incontinence. And certainly we've found that every woman that we've treated who has mild urinary incontinence or bladder issues have improved. But I've still kept it in a bracket. And then there's a condition called lichen sclerosis, which an awful lot of women also have. And that's a condition of, again, lack of estrogen. So you see it in 8-year-old children or 8-year-old girls and in the menopause. And we've noticed that when we treat the outside of the vagina for this, that also does improve. But again, I don't sell it as a treatment of that, but everybody has improved. Interestingly, it was really developed for scars on the face. So it's a carbon dioxide laser. And Stefano, who works in Milan, had a poor lady who'd had an awful delivery and terrible scarring after birth. And he tried everything to try to make that scarring better. And as almost in desperation, he used this low power laser on the woman's vagina and noticed a huge improvement. And from there, he's developed the researched into it, got data, and he started using it properly from 2012. And as I said, we used it in 2017. We initially just used it inside the vagina, but as I said, I now use it inside the vagina and on the outside in every woman, because obviously if you've got thin skin in the vagina, you very often have thin skin on the outside, so you treat the two together. As I said, it's a condition you see with decreasing estrogen levels, and it's the only non-hormonal treatment for vaginal atrophy that we can use. Just very briefly about breast cancer. Women who have estrogen positive breast tumours are very often very, very nervous about using any estrogen at all. One of the things we use in vaginal atrophy is either Vagifem or estrogen cream. The Vagifem are the little pessaries that you use. These are very, very low dose hormones, and they're approximately 1,000th of the dose of HRT tablets. And there's a lot of data to show that there's no problems at all with breast cancer and using Vagifem. But still, a lot of women who are being treated for breast cancer will not use the treatment. And that's one of the first things that I will use is estrogen in the vagina rather than leaping in and doing the laser. One of the treatments we used to use called tamoxifen is a very good treatment of breast cancer. And actually is quite good in the vagina as well, because it has estrogenic effects in the vagina. The newer treatments like letrozole and so on are very, very good at treating breast cancer, but absolutely awful in the vagina because they really can make it incredibly sore. So a lot of the patients that we see who have sore vaginas after breast cancer treatment find the MonaLisa treatment very, very good indeed when they don't want to or they can't use estrogen. What the MonaLisa Touch is not is for vaginal tightening. So this is, there are some lasers out there which are high power lasers, which essentially use scarring for mild prolapse or incontinence to scar it and tighten it up. But the MonaLisa Touch certainly isn't that. As I said, it is, does improve the feeling of laxity, but that's because it thickens it up and plumps up the vagina rather than tightening. And certainly Stefano's data from Milan has shown that, and this is now patients in their thousands, because this is a treatment now which we use all over the world. And certainly at Benetton, we've trained a lot of people from the east and west coast of America who've gone on to use it in the States. But the data now is certainly getting much better. And I would say now it's a proven procedure because of the data. A little bit of science, I guess, is all about collagen. The fibrocytes are just cells inside the skin of the vagina. And essentially what it does is it rejuvenates the collagen into a different type of collagen, which is much more elastic and thicker to give you that feeling inside. And I won't go on about the other things. What do you expect when you come to the clinic? Well, if you feel that MonaLisa would be an option for the treatment of your symptoms, you come and see me. I'm the only gynecologist at the moment who's doing the MonaLisa in Benenden. I'll see you, take a history, and then obviously examine you very carefully and gently. The basic treatment, essentially what I use, if people are willing, is, as I said, the hormone pessaries in the vagina. I quite like the Vagifem because they're little tiny pellets, little lozenges that go in the vagina and slowly dissolve overnight. I use lubricants, as in some of the lubricants you can buy are quite artificial with a lot of colour and preservatives and other things in it, which sometimes can cause an awful lot of burning in the skin of the vagina, which is obviously exactly what we don't want. So for the last few years, I've been using either olive oil or more recently, coconut oil in the vagina. And you can use that as a soap, as a moisturizer. It protects the skin very, very well. And because it's an oil, when you're walking, you get much better lubrication. And it also is mildly antiseptic. So I use that as the sort of conservative management first. If people aren't doing well with that and they still have symptoms, then they'll come in for the treatment. The vagina itself is quite insensitive to the laser treatment, but because we now treat the outside in almost every woman, then you come 10 or 20 minutes before the clinic appointment for the treatment, and we give you some local anesthetic cream to put on the outside of the vagina, especially around the clitoris, around your wee tube, so that's just inside the vagina, and in the skin between the vagina and the rectum, because those are very sensitive areas. We use a very specialized room, which is very private. I put all female, because of course I'm not female, so you have to put up with me because I do the treatment, but there are 3 nurses to manage the laser equipment, to talk you through and make sure you're okay. And then somebody will test your urine and do all the normal preoperative tests. It's a procedure, it's not an operation. And the whole thing takes about 5 or 10 minutes. Most people are very nervous because they don't know what to expect for the first treatment. So they tend to come with somebody. But when they realize how easy it is for the second and third treatments, they usually come on their own. There are 3 treatments and they're 6 weeks apart. That's important. And as I said, if you get pain after it or discomfort after it, you have the local anesthetic cream just to use. We put these pictures on. Essentially, the device is on the right-hand side. It's about the same size as your thumb, and it fits inside the vagina. So you can see that in the middle picture, and it goes into the top of the vagina or near the cervix. The machine itself is on the left. It's like a very small filing cabinet, so it's not very intimidating. The procedure is done a little bit like you see in American films with your legs up in stirrups, but that's only so that you can relax, and there's a lot of privacy. We put the device in and then we treat. Those little notches on it are the measurements. So depending on the length of the vagina, you might have 20 treatments. So you put it in, you gradually withdraw it for each treatment, those little markings. And what you essentially get is little dots inside the vagina. But remember, it's not exactly like that, but they're very low power lasers. So it's a heat treatment, but in a way it's a very mild burn. And of course, but you can't feel it inside the vagina, but that's how it works, by causing that collagen to change. The biggest side effects, we always quote bleeding or discharge. So if you've got a very, very sensitive vagina, then this treatment can occasionally cause a little bit of bleeding for a few hours or a couple of days after the treatment. Because it is causing a very mild burn, your body then will react by having a bit of a discharge, but it's almost never infection, just a discharge. And you can occasionally get some tenderness, and that's why you go home with that local anesthetic cream, but very few people have that. And because it's causing a reaction, you'll feel a swelling inside the vagina. If we're treating near the wee tube, because the patient has urinary symptoms, and very occasionally, because of the irritation, you can get some discomfort or pain when you pass urine for the first few times. Just before the treatment, we don't recommend that people do an awful lot of exercise, especially running. We don't like you to have sex 2 or 3 days before it, or use any lubrication or the Vagifem or the coconut oil. And that's because that can put a barrier inside the skin of the vagina and reduce the efficacy of the laser. Afterwards, again, because there's swelling and sometimes a bit of soreness, we again don't recommend that you have any exercise, especially swimming, running, cycling, etc., for 3 or 4 days afterwards. Again, because of the discomfort, we don't recommend sex for a week or 2 afterwards. And driving, of course, is absolutely fine usually, unless we've done a lot of treatment on the outside because of lichen sclerosis. It can be a little bit sore. So results. Well, I do claim that everybody has improved, but some people, and I'll say, some people improve that much and some people it's this much, because the results are somewhat variable. We do give 3 treatments, and that's important. So you can have an awful lot of improvement after the first, and then less after the second and third, or very little after the first and second treatments, and an awful lot after the third. So it's important you complete those 3 treatments 6 weeks apart. Everybody that we've seen with any bladder dysfunction have all improved. But again, we don't sell it as a treatment, but that's just something that has happened. I like the estrogen because essentially, if the estrogen in the Vagifem or whatever before the treatment hasn't helped, very often when you start the thickening of the skin in the vagina, it will then absorb more of the estrogen, and you'll get a fantastic improvement because of the estrogen. And if you carry on using that in the vagina, instead of there being an annual top-up where you come for 1 treatment, you very often don't have to come every year, maybe 18 months. And we've had a couple of ladies that have taken more than 2 years before they've needed their annual top-up. So that's essentially all I wanted to say, just as a very basic introduction to MonaLisa. There's lots on our website as well. Some people have asked about what other things we do at Benenden. So we're a group of general gynecologists. We concentrate quite a lot on the urogyne, whether that's prolapse or incontinence. We do a lot of keyhole surgery and treat pelvic pain and endometriosis, and obviously ovarian cysts and hysterectomies if needed. Because of 2 of our interests, we also deal a lot with menopausal ladies and obviously the MonaLisa Touch. But we've got a very good multidisciplinary team of the gynecologists, continence care advisors, physiotherapists, and theatre nurses who very often will go through your whole process and look after you. If you're a Benenden patient, you can come straight through to the physiotherapist via Benenden for pelvic floor assessment and exercise, etc. But they don't just do pelvic floor exercise, they do bladder health and bladder training. And we are one of the centres in Kent who deal with Bulkamid and Botox for bladder incontinence. And we've got a hysteroscopy clinic for outpatient procedures. So I think that's where we shall pause for a moment. And if there's any questions, I think please feed them through and I will be questioned on them.
Thank you, Mr. Connell. That was really interesting. We do have a few questions. I will just go through them now. So the first one is, are there any health risks during or after treatment?
Yeah, good question. It's essentially, the trouble with a lot of these treatments that we do, because it's a laser, everybody thinks of very high-powered lasers. The best way of thinking about it is more of a heat treatment. So it's like you very often feel a warmth inside the vagina rather than it being anything else. So there are no health risks for it because it's just like warming. As I said, the complications, I think I said, I'm allowed to go backwards. Those are the sort of side effects that we have, which is occasionally a bit of bleeding and discharge and some tenderness, but there's no risks of it. It's not a hormonal treatment. It's literally a stimulation of the skin cells to make them swell up and grow to reduce the symptoms that you've got from your problems.
Okay, thank you. Another question. Are other lasers used for this type of treatment?
Yeah, and I should have probably said that. There are 3 or 4 different types of lasers that have been used, and we looked at YAG lasers and so on. The problem I've personally got with some of these lasers is they're quite high power lasers. So there's a couple that we use, or I don't use, but there are a couple that are used for urinary incontinence and mild prolapse. And as I said, they essentially work by burning and scarring the vagina and congealing that collagen to give you the effect. One of them, you can have one treatment, and that's for laser rejuvenation as well. I don't like the data on that particularly, and I prefer the sort of slowly treatment, so the 3 treatments on low power. And there are 2 others, and I've forgotten the name, I'm terrible with names. There's another laser that is exclusively used for incontinence, but again, that causes burning underneath the wee tube to lift up the wee tube to reduce incontinence. So yes, there are other things out there, but myself and Salvatore were not particularly impressed with it. Obviously, I love this and I'm going to promote it. And certainly I've got 2 colleagues in London that have the 2 lasers, but again, they use it for slightly different reasons, but I'm not particularly impressed with the others. That's my own personal view.
Okay, thank you. I've had quite a few more questions, but I got 2 via the chat. One says, good evening, Mr. Connell. Are there any limitations as to how well it works for vaginal atrophy post partial hysterectomy, please? Literally just found out I had this last week. Thank you.
There's no, when you've had a hysterectomy, there's no difference particularly in the vagina. So partial hysterectomy, I presume that means leaving the cervix behind. So that's a subtotal. So if you have a subtotal hysterectomy, the vagina is going to be exactly the same. All you're doing is you're taking away the womb or the uterus because of bleeding or fibroids or whatever it is. If you take away the ovaries, then obviously, if you're a 40-year-old, you'll instantly go into the menopause, and you may develop this condition of genitourinary symptoms of the menopause. But the laser can be used whether you've got a womb or not. If you've got a large prolapse, so a big lump in the vagina or collapsing of the vagina, then we don't tend to do that because it doesn't help that and actually can get in the way a little bit. So if you've got all the symptoms that we've talked about and a large prolapse, we would deal with the prolapse before we did the Mona Lisa.
Okay, thank you. Another question via the chat. I've had an operation as I had skin growing over, which was unsuccessful. I've been unable to have sex for 3 years due to dryness and pain. Would this help? I'm on HRT patches. Okay,
so that's 5 questions. So the HRT patches are interesting because HRT, I love HRT, whether it's tablets, patches, gel, but that HRT is very good for your body, but it's not enough to get into the vagina. So if a lady's is on HRT, no matter what the dose, I would give the Vagifem in the vagina on top of that. So the Vagifem in the vagina will do nothing for the rest of the body, but does an awful lot of good in the vagina and the bladder, whereas the tablets or the treatment for the body isn't enough to get into the vagina. So I would always use that anyway. If this is like a skin bridge, and I sort of liken it to, if you can see that, to that little bit of skin here. So there's a growth of skin at the bottom of the vagina. Obviously, if that's a very thin, tight, somewhat scarred piece of skin, the Mona Lisa will thicken it up. But again, I don't tend to do that first. So what you would normally do first is use my coconut oil to massage the bottom of that dip to try to soften it first. If it's a very tight bit of skin, so that the actual opening of the vagina is too small to let a penis in during intercourse, then sometimes we have to make a little nick in the skin just to open it a little bit before we do anything else. Oops. So sometimes if it's just a little bit of skin, we'll do the Mona Lisa. If it's a big bit of skin covering it, then we'll make the nick and just open it first. And if there's still a problem, we then do the Mona Lisa. But always the massaging, always using the hormones. Well, that's what I like to do, if you can.
Okay. I think that relates to another question we had, which was, please, can you explain why you suggest using coconut oil? So I think that's...
So 100 years ago, when I was a baby doctor, I had this fantastic lady with similar problems to this. And she said that she had used olive oil to keep the vaginal skin healthy. And she'd used it on her children when they were in nappies, because it reduces nappy rash. So since I was quite junior, I've always said, use some olive oil, gently massage it. If you have an operation in the vagina or after childbirth, use it inside the vagina to help. But olive oil itself is a bit gloppy and smelly, and people don't like it very much. And now, of course, you can get olive oil an awful lot everywhere. And the great thing about olive oil is, coconut oil, sorry, is at autumn room temperatures, not summer room temperatures, it's fairly solid. And so you can put it on like you would put your face cream on in the morning, rather than it being a liquid. And nobody's ever allergic to it. It's a fantastic soap, because soap is very drying in the vagina, but you can use it as a soap. Because it's oil-based, it's then therefore very good at moisturizing the skin. It's a very good lubricant. And as I said, it's a mild antiseptic. So it does help to get your normal bugs healthy again, the sort of friendly bacteria. If people, which is one of the symptoms you can get with this condition, if you're getting recurrent infections, so bladder infections or infections after intercourse, and you've got the coconut oil in, which is a mild antiseptic, it can also help with that irritation when you go to pass urine. I think that's all the questions, wasn't it?
Yes, no, that's great, thank you. We have several more questions. One is, please can you explain more about the estrogen cream or the pessaries? Sorry, I'm not very good at pronouncing the words.
Yeah, so the estrogen, so there's two ways you can put estrogen in the vagina. One is cream, and it usually comes on a little soft plastic syringe, and you fill the syringe up, put it in the vagina, and you squeeze it, and the cream comes out. The lozenges, the Vagifem, which is an awful name, but Vagifem is a little lozenge. Again, that comes on a little pencil, so you can gently put it in the vagina. You push the end, and it comes off at the top of the vagina. Personally, I've had some patients who've reacted to the cream because the cream has preservatives in it, colouring and so forth. And very few people have reacted to the Vagifem because it's almost like a very thick Vaseline. And as I said, because they're very low dose estrogen, you don't tend to get any problems with it. Although a woman who has this condition, the GP or pharmacy will say you take it every day for 2 weeks or every night for 2 weeks, and then twice a week after that. But if you're doing that with a very sore vagina, that can be quite a high dose first of all. So what I tend to do is you take it twice a week for 2 weeks and then gradually build it up. But as I said, because it's 1,000th of the dose, roughly 1,000th of the dose of an HRT tablet, you'd have to take 3 years worth every night to have the same dose as one HRT tablet. So the side effects are non-existent apart from the, as I said, the irritation sometimes with the cream. And the cream also is, to me, it's a bit messy. It's a cream going into the vagina rather than this nice little lump of hard or soft Vaseline. So that's just a personal preference.
Okay, thank you. We have another related question. A lady says, I have used Vagifem and Yes Lube for quite a long time with no improvement. I bleed after intercourse. Will Mona Lisa be suitable? GP has just put me back on Oestrogel, HRT.
Yeah, so the problem with Yes, whether it's the water-based gels really shouldn't be used because they can be very, very drying. So either KY jelly or Yes water-based. There is a Yes, which is another things which are oil-based, but again, they tend to be quite mineral content, and some people can have a reaction to it. So that's why, again, I go back to my coconut oil. The Oestrogel, fantastic for the body, but not enough to get in the vagina. And as I said, if you've got a very thin skin in the vagina, it just sits there and doesn't do anything. And therefore, when you put the estrogen in, it doesn't absorb enough of the estrogen to thicken it up. So that woman, if she had Mona Lisa Touch and if it worked well, she'd then get a much thicker vagina, which would then start absorbing the estrogen much better. So she may not need any further laser treatment because she'll maintain the thickness of the vagina with the estrogen cream or gel.
Okay,
so her question was whether it would be good for her. Well, yes, because if you're splitting the skin inside because it's so sore, and you can thicken it by whichever means, and you use the coconut oil as lubrication, then yes, that might be perfect for you.
Yeah, that sounds sensible. Thank you. Had a quick question which I can answer actually, is where to buy coconut oil, and most health food shops will sell that.
Yeah, everywhere.
Yeah, it's very popular.
They come in little jars, a bit like the dipping stuff you get for tacos, and they're now so relatively cheap. When we first started using it 5, 10, 15 years ago, you couldn't get it anywhere, and it was incredibly expensive. But yeah, you just buy it anywhere. It's a cooking oil, so theoretically it's a healthy cooking oil. But and I've got patients use it for their hair, their skin, their vaginas, their nappy rash for the kids. I don't use it on my
hair. Yes, I use it for cooking. A lady says, what should I expect during the recovery period?
I guess I presume recovery means after the procedure's done. There isn't really a recovery because most people are, especially after the first treatment, are so amazed about how easy it was. The only thing I suppose is if you're really worried, you'll have lots of adrenaline going around. So because you're on a little bed with the legs up, as I said, like in the American films, we just let you sit there for a little bit longer, just in case you feel a bit faint, because it's the worry of coming in. But the second and third treatments, almost everybody is absolutely fine about it. So there isn't really a recovery. If you mean recovery as in once the swelling settles down after 3 or 4 days, then yes, that is important that you don't go off and do a marathon or have sex too early or ride bikes or ride horses, because you don't want to be hurting the vagina too much.
Yeah.
So 3 or 4 days afterwards, everybody's usually fine.
Thank you. If you have nerve damage from pre-cancer cell removal, can this treatment help that type of pain during sex?
That's an interesting one. Nerve damage from
cancer cell removal.
Cancer treatment.
Pre-cancer cell removal, yeah.
So that'll be where you take pre-cancer cells off the cervix. I don't know, to be honest. I think if you've got pain in the vagina for whatever cause, then this is not going to do you any harm. Whether it makes it better, I don't know, without thinking about it. I've not had that question before, so that's interesting. I don't know is the answer to that. It depends on what the cause of the pain is in the first instance. If it's because of unless it's radiotherapy treatment for pre-cancer cells, where you can get terrible burning of the skin and thinning. If it's for that, where you've had treatments, radioactive treatment in the vagina, 100% it will help. Okay. But again, I can't promise how much it will help, but it will certainly, and it's one of the few things you can do to thicken the skin up in that area.
Okay, thank you. Is this procedure FDA/MHRA approved?
There was a hiccup about 2 or 3 years ago with FDA approval because they put all the lasers treating the vagina in one big group, but that was lifted about 18 months ago. So it's approved, I think, as well, but don't quote me on it. This month or next month, NICE are going to approve it as well as a treatment. But I will double check on that. But certainly there's it's now fairly widespread treatment across the world, and most places will do that.
Lovely, thank you. Has anything been noticed with regards to an improved libido?
Yes, is the answer to that, because if it hurts every time you have sex, your libido will go down. If it doesn't hurt anymore when you have sex, then your libido will inevitably go up, because if you're then enjoying it, you get happy hormones in the brain, and your libido will then improve. So 100%, the answer is yes. So if we can get it so it's less sore having intercourse, your libido inevitably will go up.
That makes sense. Just a couple of questions left. How does vaginal treatment improve bladder problems?
Right, so we used, until the Mona Lisa came along, we'd used the Vagifem for bladder issues. So if you think about it, as we all age, our bladders will deteriorate. So whether it's a man or a woman. The problem with women is as soon as you hit 52 or the menopause and you lose the hormones, your bladder deteriorates much quicker than mine as a man. So for a long time, we've been using hormones, so Vagifem or estrogen cream, in the vagina to thicken the bladder so that the bladder has less irritability, but also that the muscles controlling it improve, so you get less coughing and sneezing and leaking. So of course, if we can thicken the skin in the vagina with estrogen or with the Mona Lisa, then it will thicken the skin in the bladder. So that's how it works. And as I said, that's the most likely reason for it. But as I said, it just improves all the collagen and the elasticity and the irritability by thickening it up. That's the easiest way I can see of it, why it works.
Okay, thank you. So our last question is a rather long one, so I'll try and say it slowly. Since breast cancer, chemo tamoxifen, which brought about early menopause, I can no longer have penetrative intercourse, partly due to the symptoms mentioned, but I also can no longer take anything larger than a finger, and just no amount of trying to override the pain will work. Will this treatment help with what appears to be shrinkage of the vagina capacity?
Okay, so the first thing is if you can't get your finger in and the Mona Lisa is the same size as my thumb, then that may be one issue. If it's because of scarring at the opening, then as I said before, you may have to make a little nick to just open the opening. But yeah, I mean, the whole point of using tamoxifen, as I said, is much less of a problem for this than letrozole and newer ones, but women still get it because it's an anti-estrogen. So I think without pushing you to come and see somebody, but you need to be examined to see exactly what the problem is. If it's the scarring on the outside that you can't get in, but inside is much better capacity, then making a little nick may help. And of course, if you think about it, if you've got very sore skin at the opening of the vagina, then having sex can split the skin. When it heals in a catabolic way rather than a young anabolic way, and that scarring gives you more scarring and more fibrosis. So you end up with getting more, so cut down here, more and more scarring and a tighter vagina, which is very inelastic. So sometimes you do have to make a little nick in order to open it till you get the capacity back. But again, the first thing I would do is, if you're not keen to have estrogen, would be to use the coconut oil and gently massage the back end where that scar tissue could be. And then if that doesn't help, then to be examined and decide which way we're going to go with that.
Thank you. Okay, so that's all the questions we have time to answer today. If we haven't answered your question, then please do just send it again with your name, and no one else will see, and then we can get back to you, or email the email address with the question, and we'll get back to those. So thank you very much, Mr. Connell. It was really interesting.
Thank you.
Thank you. After this presentation, you'll receive a short survey just to get really gain your thoughts on what you liked and didn't like and what we can improve for next time. So please do feedback. And why not join, as you can see on the screen, our next gynecology webinar with consultant gynecologist Mr. Gupta and our specialist nurse Jan Chaseley to find out how to control your bladder with specialist treatments. We also have an orthopedic webinar on the 9th of September. If you want to join that, or you know someone that would be interested on hip or knee replacements. So on behalf of Mr. Connell, myself and the team at Benton Hospital, I'd like to say thank you very much for joining us today, and we look forward to seeing you again soon. Thank you.
Thank you. Bye-bye.
Bye. Bye.